Hello everyone. Can someone confirm if I'm audible?
Yes, ma'am.
Okay.
Yes, ma'am, audible.
Okay. So good evening everyone. Welcome to the 12th TA
Good
session
morning.
or the last TA session for drug delivery principles and engineering. Today also we'll discuss the previous year assignment. This entire session will be recorded and will be uploaded on YouTube. You'll also get the presentation that we'll be sharing today over Google Drive. So we'll start the session. I'll be sharing my screen now. Let me know if you guys can see the screen. Is it visible to everyone?
Yes, ma'am.
Yes,
Okay.
ma'am.
Okay. So let's start the session. So these were the topics that were covered in the previous week: responsive drug delivery systems, targeted drug delivery systems, nanotoxicology, and translation pathways. So here is the first question. What are GMP and QS regulations? Options are: the QS regulations apply to drugs which are being tested in vitro. GMP regulations apply to things which are intended to be used in humans. Contamination can be caused by residues of cleaning agents. Quality check is ensured at the end of the manufacturing processes.
Ma'am, second option.
Okay. Anyone else?
Ma'am, I think so. Last option.
Okay. Okay. Let's see the answer. So it will be the second option only. GMP regulations apply to things which are intended to be used in humans. So GMP and QS are good manufacturing practices and quality system regulations. So as you see, GMP is good manufacturing practices. So not only at the end, starting from the beginning, you have to take measures that everything is being followed in a proper way and the quality is ensured throughout the manufacturing processes. So these regulations require that the domestic or foreign manufacturers have a quality system for the design, manufacture, packaging, storage, installation, etc. Intended for clinical trials and commercial distribution. And anything used in humans should follow these guidelines. So GMP regulations apply to things which are intended to be used in humans will be the correct option. Okay. So here is the second question. So NIPAM is a temperature responsive hydrogel. The following are its characteristics. Their water solubility increases with temperature. Their water solubility decreases with temperature. They consist of polymer chains which are made up of hydrophilic segments only. Van der Waals forces are the predominant forces that are responsible for dissolution in water. As the temperature increases, the hydrogels become more porous. More hydrophobic content in the polymer leads to animals such as primates. What is the characteristics of this hydrogel, temperature responsive hydrogel? Anybody?
Ma'am, fifth one.
Fifth one. Okay. The hydrogels become more porous. What about others? Anybody else would like to answer? Okay, so here the correct answer would be the second option. That is, their water solubility decreases with temperature. So temperature responsive hydrogels, these are basically made up of polymers that increase their water solubility that decrease their water solubility as the temperature increases. So some polymers decrease their water solubility as temperature increases. This temperature is lower critical solution temperature, and these hydrogels made up of LCST or lower critical solution temperature shrink as the temperature increases above the LCST. So what happens exactly is, as the temperature increases, the hydrophobic interactions among the hydrophobic segments become strengthened, and the hydrogen bonding becomes weaker. So the net result is shrinking of the hydrogels due to interpolymer chain association through hydrophobic interactions. So at lower temperatures, the hydrogen bonding between hydrophilic segments of the polymer and chain water molecule dominates, but at higher temperature, the hydrophobic interaction dominates, making them less soluble in water. This is the third question. What happens during phase 3 clinical trials? You have to select two correct options. Options are: safe dosage is determined, the study is localized to a very specific region and age group, it is generally a multi-layer and multi-center process, studies are performed on large animals such as primates.
I think first and third.
First and third. Okay. Anybody else?
Ma'am, third one.
Third one. And you have to select two correct options. 1 and 4 also. Okay. Okay. So the correct answer would be first option and third option. That is, safe dosage is determined and it is generally a multi-layer and multi-center process. So these are the different trials and what happens in them. So phase 1, it requires a very small numbers to assess the product safety, and it's generally localized to one or two centers. Then phase 2 studies a proper or safe dosing and potential efficacy. And the final or phase 3 is a pivotal study, which is well controlled clinical trial and supports safety and efficacy leads to FDA application for pre-market approval, and it is a multi-center involvement. So these two options, that is safe dosage is determined and it is generally a multi-layer and multi-center process, will be the correct option. Here is,
Ma'am,
yes,
third question in the assignment they given only three options, ma'am. We have to choose only one correct option.
sorry.
In assignment they given only three options, ma'am.
Okay, I think they might have modified the question. This is the previous year question. So you can select one
Oh,
option also.
then safe dosage is determined is correct answer, ma'am.
It should be. But this is more relevant because safe dosage is also determined in the phase 2 and phase 1 also. Final safety dosage is determined in the phase 3, but more appropriate would be multi-layer and multi-center process, I would say.
Okay, ma'am. Thank you, ma'am.
Okay, here is the fourth question. What is meant by sterilization? Improving the quality, improving the concentration of product, elimination of contamination, or purification of products.
Ma'am, elimination of contamination.
Okay,
Third option, ma'am.
Ma'am, pure product, it is also maybe correct only, no?
uh, no, it is only elimination of contamination. Purification of products is completely different. Uh, so if I have to explain, proteins you can purify by running through a column or something, that you get the pure product, right? But it might be
Yeah.
still contaminated with something, and that is different. So you can either give UV or something to remove the bacterial contamination or fungal contamination that might come. So there, that is elimination of contamination, basically the sterilization process.
Okay, thank you, ma'am.
Okay, here is the fourth question. Fifth question. Which of the following are not examples of active targeting? You have to select two correct options. Lactin carbohydrate interaction, ligand receptor interaction, antibody antigen interaction, APR effect, direct local delivery to target organ.
Ma'am, last two options.
Okay. Others? Anybody else would like to answer? Which is not example of active targeting? One and four, okay. Okay. So here the correct answer would be the last two option, as someone already said. So this is EPR effect and direct local delivery to target organ. So mainly targeting could be either passive or active targeting. In the passive targeting comes the EPR effect, tumor environment, direct local delivery, where you are indirectly targeting these for these diseases or specific tissue or cell, but then you are indirectly targeting it. But if you want to directly or actively target it, you can use the lactin carbohydrate interaction, ligand receptor interaction, or antigen antibody interaction. Okay, here's the sixth question. What are the main disadvantages of aptamer? You have to select two correct options. They do not interact with positively charged protein targets. They do not interact with negatively charged targets. Aptamers cannot be synthesized, can be detected by toll-like receptors, not clinically significant.
Option 3, 5.
3 and 5. Okay.
Option first and fourth.
First and fourth, okay. What about others? What are the main disadvantages of aptamer?
Ma'am, not clinically significant
Okay,
and can be detected by toll-like receptors.
okay, okay. So here the main disadvantages would be one, they do not interact with negatively charged targets and can be detected by toll-like receptors. So basically these aptamers are most of the times they are small DNA strands, you can say, that can be actually synthesized, and so these are already negatively charged, so most of the times they cannot interact with other negatively charged, they can only interact with positively charged. So these are the main shortcomings. Due to their negative charge, they don't interact with negatively charged targets and could be detected by toll like receptors as foreign DNA. So these two options will be the correct answer. Okay, here is the seventh question. Which of the following statements is false for enteric coatings? pH responsive, insoluble at low pH, insoluble at physiologic pH, protects acid sensitive drugs from gastric juices, allowed delivery of drugs in the stomach, deliver drugs to the small intestine, can be made of polycarboxylic acids.
Fourth option, ma'am.
Okay,
Fourth option, ma'am.
okay. Anybody else would like to answer?
Fourth one, ma'am.
Okay. Okay, you all are correct. It is the fourth option, that is allows delivery of drugs in the stomach, rather than it does not allow it prevents delivery of drugs to the stomach. So pH responsive enteric coatings are mainly made up of polymers that protects this degradation of these drugs or the coating in the acid labile environment of the stomach, that is to protect sensitive drugs from gastric juices, to prevent absorption of certain drugs in the stomach, and to deliver drugs to the small intestine if that is the prime absorption site. And modern enteric coatings are based off polycarboxylic acids that are hydrophobic and water insoluble at a low pH and become water soluble at a higher pH. So allows delivery of drugs in the stomach will be the correct option. Okay, poly-N,N-diethyl-acrylamide is widely used as a temperature responsive hydrogel because of its LCST in the range of which temperature? You can go through all the options and let me know what you think the answer is.
Second option, ma'am.
Okay. Anybody else? Anybody else would like to answer? Okay. Here the first option will be the correct answer, that is 25 to 32. So uh, polyaniline diethylicrylamide is widely used because of its LCST in the range of 25 to 32 degrees Celsius. So as we discussed before, LCST is the temperature above which the solubility of the polymers decreases in water. So most these are used, you can imagine in this way, that above 32, that is basically in the body temperature 37 degrees Celsius. If you want to form the hydrogel, then this is the best temperature, 25 to 32. So if it is above 32, then only it will form hydrogel. But if you see rest of the options, it will require higher temperature if it is between 30 to 37 or 25 to 37 or even higher. So because it lies in this range 25 to 32, which you can say normal room temperature, it will be liquid. But at body temperature, that is above 32, at 37 degrees Celsius, it can become a hydrogel. So this is how temperature responsive hydrogels. This is why polyaniline diethylicrylamide is used as a temperature responsive hydrogel. Okay, here is the next question. Which of the following functional groups would make coating non-labile to acid damage in stomach? We just discussed about this enteric coating. Can you tell me what is the answer?
Maybe amino group.
Ma'am, carboxylic acid group, I think.
Okay. Others? Just now we discussed about enteric coating.
Carboxylic acids, ma'am.
Okay. What about others? Okay. Yes, carboxylic acid group will be the correct answer. So these carboxylic acid groups, when they are at low pH, they are protonated, so they have low solubility. But when they are deprotonated, they become highly soluble. That is why carboxylic acid based coatings are used, that at pH 8, which is in the small intestine basically, they will dissolve there. Instead at acidic environment, that is pH 2 or lower pH in the stomach. So carboxylic acid group will be the correct answer. Okay, we are at the last question now. Here is the 10th question. What assays can be conducted to test for nanoparticle toxicity in vitro? You have to select two correct options. Protein estimation, hemolysis assay, cell metabolism assays, transfection.
Second and third.
Second and third, okay.
Hemolysis
Second and
and
third.
cell metabolism.
Hemolysis assay and cell metabolism assay.
Okay. Yes, you guys are all correct. It will be the second and third options. So basically, you can keep these nanoparticles in RBCs and also in presence of cells to check either the hemolysis assay or the cell metabolism assays. Okay, so we are at the end of all the questions. Anyone has any doubt in whatever question we discussed till now? Else I'll start from the beginning again for those who joined later. And someone was asking about hall ticket. We don't know about that. You can ask in the forum about your hall tickets. Yes, anyone has any doubt? Or shall I start again from the beginning?
Madam, small doubt, ma'am.
Yes, yes.
Ma'am, small doubt. Up to now, I have attended all the assignments and have listened all the recorded classes and everything, live sections. But if only two assignments, I got only 90% out of these the 11 assignments. But in coursework, I have got only 66.32%, ma'am.
I'm not sure what you're trying to say actually.
What I'm trying to tell means up to now, the week 11, I got a all assignments. I got the 100% marks.
Okay.
Only two assignments I got only the 90%. Only two.
Okay. Even then your percentage decreased, you're saying, right?
Yeah, ma'am. But in coursework, in when we have click on this, the progress of our coursework, there is showing only 66.32% is there for me.
Is it the same for others as well?
No, ma'am.
What is the percentage showing for you?
Ma'am, it's 90% for all.
I see. Maybe you can raise the concern in the forum itself that you
On the
attended
Ma'am,
everything.
overall course progress
Showing
they are asking,
technical
ma'am.
issue. Sorry,
Overall course progress is being discussed.
is being discussed where?
I mean, I'm asking like now we are discussing the overall course progress.
yeah. Yes, yes.
Yeah,
Overall
then it is like for me it is showing some 90% and above 91 or 92.
Ma'am, to whom I must ask all
In the
doubt? I have
forum.
put the question in the ask a question forum also. It is a right
uh,
platform to ask.
You have asked in the forum also, is it?
Forum means where I need to click. Where I need to click, ma'am?
Uh, Others can tell this better, I guess. How do you guys access the forum?
When we just go to the normal course only, then only it will be there, ma'am. Actually, announcements section there, forum, it will redirect to forum.
Okay, you can try that because we don't have access to the
It's like
present
ask
page.
a
Ma'am, you
question like
can
that.
you can ask in question answers section. I
Yeah.
think there is a section of
Ah,
question
Ask a
answer.
question is there.
yes, ma'am. Yes, ma'am. I have answered the same the question in question and answer section also, but they know. I think so. They have given one email address for me. I also put the same
Yes, ma'am.
question that email also, but I have not received any answer from through that. Kavita, I think so. Think so.
Uh,
Kavita is there in address email address.
Kavita. Okay,
Something Kavita like that.
okay. I'll ask other TAs who are also. I'm sorry, I couldn't hear you. Can you repeat again?
But answers are all correct, ma'am.
It's not very
But
clear what your
answers are correct, ma'am.
answers are correct. Can you type? Because I'm not able to clearly understand what you're trying to say.
Maybe what they are trying to say is that in many assignments, though we have got like 10 out of 10 questions, what are 10 out of 10 correct, but also the
No,
scores are like
ma'am. When we
85,
submitted
90,
assignments,
like that it is showing.
But also what?
Like, even though like all our answers are correct for the
Correct?
course, we cross-check with the TA sessions, but
Hmm.
also the score is like not 100. It is 85, 88, 90,
oh, its
95,
I
its
like
score
see.
that.
is zero only, ma'am. It's not improved.
Course progress. Course
That
progress,
is
ma'am.
why I was telling you, know, some questions are modified slightly. So in one of the previous sessions, I think I also told that two options were correct. So if they have given only one option to be correct, then your answers might be wrong. So you have to. That is why I asked you guys that you can put in the forum also that both these answers will be correct. I'm not sure how they have corrected it, but there were two correct options, but it was only showing one when we were discussing also. Do you understand what
Ma'am,
I'm trying to say?
yeah, ma'am.
Ma'am, now
Small doubt.
we will.
Yes, one by one. Miss Bhavani, can you go first?
Yeah. Yeah. Ma'am, but the why means up to the 11 assignments, only the two assignments, the 90 marks or 90% is there. But every two assignments only I got the least marks, but in every assignment I got 100% or 100 marks, whatever it may be.
Okay.
But course for progress is there in the right side of the page. It's showing only 66.3%.
And you had to only submit the assignments, right?
Yeah,
There
I
was
submitted all assignments, ma'am. Individual, like week one assignment, I got 100%. And I think so in the second, and I saw eighth assignment, only these two assignment, I got 90%. That's all.
I see.
Remaining, I got
I think
100.
it might be a technical issue. I'll let other TAs know who handle these technical things. Okay.
Ma'am, otherwise, can you tell any other mail address to put the
Um,
mail?
I'm not sure what mail address should be correct. So yeah. So uh, they asked you to send to whom? Actually, Kavita, was it?
Yeah, ma'am.
Can you tell the email address that they asked you to mail?
Okay, I think now I'm not having that mail address, madam. Kavita, I think so. Kavita is there. That is the name I remind. That's all. And
Okay,
also another mail also they have given that is the regarding to the NPTEL is there, that is in that mail also address.
I see. Um, because I'm not sure. I only know the TAs that are handling these question assignment submission and uploading and submission these things. So I can maybe talk to them. I can you can give me your mail ID here. I can reply you back on that.
Yeah.
Or you can mail me
O-
in my mail ID as well. I can reply you back on that.
okay, ma'am. Shall I send my mail ID, ma'am?
Sorry?
Okay, shall I send my mail ID here, ma'am?
Yeah, you can.
Okay, thank you, ma'am. Now I'm putting my mail ID.
Okay. Yes, now Miss Jalapati Abhigna, you wanted to say something? Hello?
Can we leave, ma'am?
Hello.
Yes,
Ma'am,
you are.
I got all the answers correct, ma'am, but my score is represented as zero, ma'am, for fifth and sixth week, and also for 7 and 8 also, ma'am.
You submitted all the you attempted all the answers and submitted the assignment. Even then, you are getting zero. You are saying.
Ma'am,
I see. This is another technical issue, I would say. Did you try putting in the forum as
So,
well that this is what
but
happened?
overall score is 20% only, ma'am.
Sorry?
In right side of the corner, we will see course marks, ma'am. In there, 20 percentage is only there, ma'am.
Yes, I'm saying it would have been better if you just put a screenshot and mail them that I attempted these questions and I got these marks, but then still I am not getting the percentage that I should get. Because these are all
Okay, ma'am.
technical issues. So we are not handling these technical issues. So I'm not very sure what to say to these things.
Ma'am, can you send that mail for whom we have to send, ma'am?
I that is what I don't know the mail, but I know the TAs who are handling these technical things. I can ask them and then let you know what who should you mail or who they what
Okay, ma'am.
should you do. Yeah.
Okay, ma'am.
Ma'am, here I send my mail address.
Yes, yes.
How,
I just saw.
how,
Yes.
yeah, thank you, ma'am.
If I know if I get any answer, I'll mail you back on that.
Okay. Otherwise, shall I send them personal mail to you, ma'am? Everything screenshot and
Yes,
everything.
yes, yes. You can.
Can you give? Can
I'll
you
try
give,
to
ma'am?
provide. Yeah.
Can you give her mail ID, ma'am?
Uh, is it not given there in the sheet that is uploaded there? The Google Drive link that is shared with you, no? That mail ID
Yeah.
only.
Okay, ma'am. Tomorrow I will send, ma'am.
Yeah. Someone just asked, assignment question is repeated on final exam. I'm not sure if it will be repeated, but you might get similar question to these, or it might be subjective type as well. So yeah, it can be anything. Be prepared for both multiple choice and subjective type questions. Okay. So shall we start from the beginning again or
Yes, ma'am. From beginning, few questions we missed out.
okay. I hope you can see my screen.
Yes, yes, ma'am.
Okay. So this was the first question. What are GMP and QS regulations? So the QS regulations apply to drugs which are being tested in vitro. GMP regulations apply to things which are intended to be used in humans. Contamination can be caused by residues of cleaning agents, and quality check is ensured only at the end of the manufacturing process. So the correct option here would be GMP regulations apply to things which are intended to be used in humans. So GMP or good manufacturing practices and quality system QS or quality system regulations, they require the domestic and foreign manufacturers to have a quality system for everything, that is design, manufacture, storage, installation, everything that is intended for clinical trials and commercial distribution, and anything to be used in humans should follow these guidelines. Okay, so this was the second question. Nipam is a temperature responsive hydrogel. The following are its characteristics. Their water solubility increases with temperature. Water solubility decreases with temperature. They consist of polymer chains which are made up of hydrophilic segments only. Van der Waals forces are predominant forces that are responsible for dissolution in water. As the temperature increases, the hydrogel become more porous, more hydrophobic content in the polymer leads animals. In the polymer leads animals such as primates. Okay. So temperature responsive hydrogels, the main characteristics of these are their water solubility decreases with temperature. So at higher temperature, they will be less dissolved, less soluble in water, and there is a lower critical solution temperature. So beyond this temperature or above this temperature, they are less soluble, and below this, they are more soluble in water. So above this temperature, what basically happens is the hydrophobic interactions become more dominant as opposed to the hydrophilic interactions that is there below this LCST, and above this LCST the hydrophobic interactions become more dominant and the hydrogen bonding becomes weaker. So the net result is shrinking of the hydrogens due to interpolymer chain association through hydrophobic interactions. Okay. So this is the third question. What happens during phase 3 clinical trials? You have to select two correct options. Safe dosage is determined. The study is localized to a very specific region and age group. It is generally a multi-layer and multi-center process. Studies are performed on large animals such as primates. So here the correct
3 and
answer
4,
would,
ma'am. 3
yes,
and 4. 3
3,
and 4.
uh, no. Anyone else? Anyone else would like to answer? You said 3 and 4, right? Well, 3 is one of the correct answers. It is generally a multi-layer and multi-center process. The other correct option would be safe dosage is determined. So studies are performed on large animals such as primates. These happened before, even before the clinical trials, you can say. So in the clinical trials, this is basically what happens in phase 1. Small number of people are used to assess the product safety, and it is generally localized to one or two centers. Phase 2 again tests for the proper safe dosing, potential efficacy, and phase 3, that is pivotal study, it is a well controlled clinical trial that supports safety efficacy, leads to FDA application for pre market approval, and it is a multi center involvement. This was the fourth question. What is meant by sterilization? So here it will be elimination of contamination.
Of contamination.
Yeah. This was the fifth question. Which of the following are not examples of active targeting? Would you like to answer?
Ligand receptor interaction. No?
And one more.
EPR is for tumors, so it is also like not specific tumor region, only where gaps are there, it is going and targeting.
Right. Okay. One option is correct, that is EPR effect. Another would be direct local delivery of target organ. Here also you are locally delivering and then it is just diffusing everywhere. It is not targeting a specific region. So you can say EPR effect and direct local delivery of target organ as two examples of not examples of active targeting. They are basically passive targeting. So here it can be either passive targeting such as EPR effect, tumor environment, direct local delivery, and active targeting involves lectin carbohydrate interaction, ligand receptor interaction, antigen antibody interaction. These interactions are very specific and can happen in only specific regions. So that is why these are called active targeting. Okay, what are the main disadvantages of aptamer? What do you think the answer is? You have to select two
They do
correct
not
options.
interact with negatively charged targets, and they can be detected by toll-like receptors.
Yes, these two options are correct. So they are basically they itself are negatively charged, so they don't interact with other negatively charged targets, and they could be detected by toll-like receptors as foreign DNA. So these two are the main disadvantages of aptamers. Here's the seventh question. Which of the following statement is false for enteric coatings?
Allow delivery of drugs in the stomach.
Yes. So except for allowing delivery of drugs in the stomach, rest of the options are correct. It is pH responsive, low, insoluble at low pH but soluble at physiologic pH, protects acid from drugs from gastric juices, delivers to small intestine, and can be made of polycarboxylic acids. So poly-NN diethylicrylamide is widely used as a temperature responsive hydrogel because of its LCST in the range of, what is the LCST temperature range of poly-N diethylicrylamide?
25 to 32, like physiological temperature.
Okay. Yes, 25 to 32 will be the correct answer. Above this temperature, it will mostly less dissolve in water, and that is why it can be used as temperature responsive hydrogels. Which of the following functional groups could make coating non-labile to acid damage in stomach?
Carboxylic acid group.
Yes, correct. So these carboxylic acids at low pH, that is in stomach or acidic pH, they are protonated, so they are less soluble. But at higher pH, slightly higher pH, such as in small intestine, they are deprotonated and become more soluble. What assays can be conducted to test for nanoparticle toxicity in vitro? Two correct options.
Hemolysis assay and cell metabolism assay.
Yes, correct. So hemolysis assay, you can incubate these nanoparticles with RBCs to check their activity on uh, red blood cells or effect of these on blood cells, and cell metabolism assay you can measure as well by incubating these particles along with cells, and you can put another detecting agent to measure the cell metabolism. Okay, so we are done. Do you want me to repeat any other question again?
No, no, ma'am. Yes.
Okay. What about
Ma'am,
others?
is there like any along with the assignments for reference? Is there any like sample questions so that we can refer it for practice and all? I mean, apart from the assignment questions.
Um, I think you can find previous year assignment questions from internet. I'm not sure, but yeah, you can just follow the lectures very thoroughly. It will be mostly based on that only. Sample question, I'm not sure
Ma'am,
if
for
you will get any.
like how many questions we have, ma'am? Like in total for this paper.
Oh, that I'm not sure.
Okay.
We are
Okay.
not part of designing the paper question.
Curriculum and all.
Yeah.
Okay. Yes, ma'am. The
Okay.
hall ticket thing should be posted in the forum, ma'am, because it is
Yes.
because exam is like 10 in 2 weeks. It is in 2 weeks, and still we didn't get any intimation about hall ticket. We
I
have to
see.
see where we got the center and all. You have to plan accordingly.
Right, right. You can put in the forum that the sooner you get, the better would be like that. And
Okay.
yeah,
Sure, sure. Yes, ma'am. That would be. Thank you so much, ma'am.
welcome. Any other questions? Anyone? Do you want me to repeat any question again, or do you have any other doubt? You can comment also if you don't want to speak. Do you want me to discuss or ask anything? You can let me know.
Madam, can we come again the last 12th week question again, madam? I joined late.
You want me to go through all the questions again?
Yes, ma'am.
Okay,
Please.
sure, sure. I'll go. Yes, Mr. Darshan Lokhande, what is your doubt? Someone raised the hand. You can speak up. So whoever is facing this progress problem with the course progress, that after submission of all assignments still you are not getting the course progress at 90% or more than that, 80-90%, and you are getting very less course progress, this is the technical issue. You can post in the forum. They can help you with this. Okay, so I'll share my screen now and we'll go through the questions again. I'll not discuss the questions in details again. You can stop me if you want me to discuss in detail, or I'll directly go through all the questions. Can you let me know if you want in detail or just the questions? John, can you hear me?
Yes, ma'am. Questions will do, madam.
Okay. You can stop me wherever you want. I can discuss them again. Okay.
Okay, ma'am.
Okay. So this was the first question. What are GMP and QS regulations? So out of all these options, the second option will be the correct answer. With GMP regulations apply to things which are intended to be used in humans. So GMP is basically good
Screen,
yes,
screen is not visible, ma'am.
it's not visible. I have shared my screen. Okay, I'll try to share again. Can you see it now? Is it visible now?
Yes, ma'am. Now it is visible.
Okay. Okay, so this was the first question. What are GMP and QS regulations? And these were the options. Regulations apply to drugs which are being tested in vitro. GMP regulations apply to things which are intended to be used in humans. Contamination can be caused by residues of cleaning agents. Quality check is ensured only at the end of manufacturing practices. So out of these options, the second option will be the correct answer. That is, GMP regulations apply to things which are intended to be used in humans. And these are basically good manufacturing practices and quality regulations that to ensure the quality of the product throughout from the beginning of the design and manufacture to the end distribution. And this is for products, all kinds of products for that is used for clinical trials or commercial distribution. And these should always follow guidelines, GMP or QS guidelines. This was the second question. Napalm is a temperature responsive hydrogel. The following are its characteristics. So here the characteristics of the temperature responsive hydrogel is their water solubility decreases with temperature. So these temperature responsive hydrogels have a lower critical solution temperature. Below this temperature they are liquid, and above this temperature liquid or soluble in water, and above this temperature they are less, their water solubility decreases. So what happens is that lower temperature, the hydrogen bonding prevails, because of which the hydrogen bonding between hydrophilic segments of the polymer chain and water molecules dominates, leading to dissolution in water. And above this temperature, hydrophobic interactions predominates, making and the hydrogen bonding becomes weaker. So the interpolymer chain association through hydrophobic interactions increases, making the polymer less soluble in water. What happens during phase 3 clinical trials? You have to select two correct options. So here safe dosage is determined, and it is generally a multi-layer and multi-center process would be the correct options. So in first phase, product safety is phase 1 product safety is checked, phase 2 also safe dosing and potential efficacy, and phase 3 again safe dosage and efficacy, as well as it is a multi-center involvement. So the first option and third option will be the correct answer. Fourth question was, what is meant by sterilization? This is basically elimination of contamination. Fifth question, which of the following are not examples of active targeting? So here, EPR effect in direct local delivery to target organ. These two options are not examples of active targeting. These are passive targeting, whereas lectin carbohydrate interaction, ligand receptor interaction, and antigen antibody interactions are all active targeting. So the last two options will be the correct answer. This is the sixth question. What are the main disadvantages of aptamer? You have to select two correct options. So here the correct options would be they do not interact with negatively charged targets, because these aptamers itself are negatively charged. So they do not interact with negatively charged targets, and they can be detected by toll-like receptors, as these can be detected as foreign DNA by the body. So these two options will be the correct answer. Seventh question, which of the following statement is false for enteric coatings? pH responsive, insoluble at low pH, soluble at physiologic pH, protects acid-sensitive drugs from gastric juices, allows delivery of drugs in the stomach, delivered drugs to small intestine, can be made of polycarboxylic acids. So rest of the options will be correct. The only option that is wrong is allows delivery of drugs in the stomach. Rather, it prevents delivery of drugs to the stomach and delivers drugs to small intestine, basically higher pH, and prevents degradation at uh, acid environment in the stomach. This was the eighth question. Poly-NN diethyl PDAM is widely used as a temperature responsive hydrogel because of its LCST in the range of, correct answer would be 25 to 32 degrees Celsius. So it is used as temperature responsive hydrogel because after this temperature, that is above 32 degrees Celsius, it can form hydrogels, and you can form hydrogels in vivo or in body temperature, that is 37 degrees Celsius. So within this temperature, below this temperature range, it will be liquid, and above this temperature range, it will become less dissolved in water and it can form the hydrogen. 25 to 32 degrees Celsius would be the correct answer. Which of the following functional groups would make coating non-labile to acid damage in stomach? So here carboxylic acid group will be the correct answer. Just now we discussed about enteric coating. So if you make the enteric coating with carboxylic acid groups, you can prevent degradation in the acidic environment because carboxylic acids are protonated in and have low solubility in acid environment, whereas at pH 8, such as in the small intestine, these carboxylic acids get deprotonated and have high solubility. And this was the 10th question. What assays can be conducted to test for nanoparticle toxicity in vitro? So here the correct answer would be hemolysis assay and cell metabolism assays. Okay. I hope you got to, you could get all the questions.
Yes, ma'am. Thank you so much.
Okay. Any question you want me to discuss again?
No, ma'am. Thank you.
Okay.
Excuse me, ma'am.
Yes.
What's the minimum percentage criteria of course progress required for exam?
What is the meaning of percentage criteria?
Minimum percentage criteria
Minimum percentage criteria. I'm not sure.
required for exam.
I'm not sure.
About course progress.
You are also getting very low percentage.
Yes, ma'am.
Okay. I think others were also facing the same problem we're discussing now. It is a technical issue, I guess. You can post in the forum that you submitted all the question even though the progress is showing very less.
Yes, ma'am. I have submitted all my assignments with 100%, and question arises with lesson progress. There are very minimum, very low percentage which are getting me about lesson progress, ma'am.
Yes, I understand. And that is what I'm saying. Others were also facing the same problem. I think you can post in the forum that you are facing such problem. This is a technical issue, I guess. I'm not sure what is the minimum criteria, like minimum percentage to appear on exam or something like
Okay, ma'am. Thank you, ma'am.
that. Okay. I think 3 people joined just now. We can discuss again. We can wait for another minute or two if anybody else is joining so that we can repeat again from the start. And others who have already attended, went through all the questions, if you want, you can leave the session because we'll be discussing the same question again. Or if you have any doubt, you can ask now. Okay. So I guess we'll start from the starting again. Can someone just confirm that I'm audible? I'm not sure if you'll get any mock test. You can search for previous assignment questions from previous years, but I don't know if there is any mock test. You can go through the lectures. That will be sufficient for the final exam.
Okay, ma'am.
Yes. Someone was saying something. Okay. I'm sharing my screen again. Let me know if you guys can see my screen. Is it visible to everyone?
Yes, ma'am.
Okay. So this was the first question. What are GMP and QS regulations? I'll give you some time to go through the options. Let me know what you think the answer is. And we'll discuss the answer again. Do you want to answer now? What are GMP and QS regulations? Okay, just let me know if you want that I should just go through the question answers directly or should I wait and discuss with you guys? Hello? Am I audible? Hello?
Yes, ma'am.
Okay. Amrita, do you want me to discuss the questions or just go through all the question answers just like that?
Ma'am, question answer
with discussion?
Yes, ma'am.
Okay. Should I wait for you to answer or should I answer directly?
Give the direct answer, ma'am, please.
Okay. Okay. So this was the first question. What are GMP and QS regulations? So here the correct answer would be GMP regulations apply to things which are intended to be used in humans. So GMP good manufacturing practices, and QS is quality system regulations. So these provide guidelines to domestic or foreign manufacturers to have a quality system for the design, manufacture, packaging, starting from the start to end of servicing of finished medical devices intended for clinical trials and commercial distribution. So anything used for this purpose should follow these guidelines. Second question was NIPAM is a temperature responsive hydrogel. The following are its characteristics. So the correct option here is their water solubility decreases with temperature. So these polymers have low critical solution temperature. Below this temperature, the hydrogen bonding is more prevalent. So and that's why they are more dissolved, leads to more enhanced dissolution in water. And above this temperature, the hydrophobic interactions are more prevalent and hydrogen bonding becomes weaker, making it more less dissolved in water at a temperature above the LCST. So their solubility decreases with increasing temperature because of increasing hydrophobic interactions. Now this was the third question. What happens during phase 3 clinical trials? So here the correct options would be safe dosage is determined and it is generally a multi-layer and multi-center process. Now this is the fourth question. What is meant by sterilization? So here the correct answer would be elimination of contamination. This was the fifth question. Which of the following are not examples of active targeting? You have to select two correct options. So here EPR effect and direct local delivery to target organ. These are not active targeting, rather these are passive targeting. Lactin carbohydrate, ligand receptor and antigen antibody interactions. These interactions are part of active targeting. And EPR, tumor environment and direct local delivery, these are part of passive targeting. So here is the sixth question. What are the main disadvantages of aptamer? You have to select two correct options. So here the correct options would be they can be detected by toll-like receptors and they do not interact with negatively charged targets. So they have their own negative charge, so they don't interact with other negative charged targets, and they could be detected by toll-like receptors as foreign DNA. Which of the following statement is false for enteric coatings? So here the correct answer would be allows delivery of drugs in the stomach. So it prevents delivery of drugs or degradation of drugs in the stomach. Eighth question was poly-NN diethyl is widely used as a temperature responsive hydrogel because of its LCST in the range of, so here 25 to 32 degrees Celsius will be the correct option. This has LCST in the range of 25 to 32. Which of the following functional groups would make coating non-labile to acid damage in stomach? So here the correct option would be carboxylic acid groups. So these carboxylic acid groups at low pH, they are protonated, so they have low solubility, but at high pH, such as in the small intestines, they are deprotonated and they are highly soluble. So enteric coating, the non-labile acid damage coating can be made of, you can make it of carboxylic acid groups. This was the last question. What assays can be conducted to test for nanoparticle toxicity in vitro? So here the correct answer would be hemolysis assay and cell metabolism assays. These two assays you can do in vitro, wherein you can incubate these nanoparticles with RBCs or with just the cells, normal cells, the cells you are going to target, and then you can test their toxicity based on their activity. Okay. Do you have any doubt in any question that I discussed, or you want me to go through any question again? Hello?
No, ma'am.
Okay. What about Prema, Miss Prema? Do you have any doubt, or you want me to go through any question again? Okay. Then we'll close this session now. Have a good day.